Sophia, have you ever felt scared or confused at the doctor's office? I have. Every time I go, the doctor uses big, fast words I don't understand. I just want to get better, but I leave feeling lost and confused. Then at the pharmacy, it's even worse. The man there talks so fast with medicine names I don't know. I feel helpless and worried, like no one cares if I understand or not.
You're not alone, Ramo. Many people feel the same way, scared, confused, and tired of trying to understand doctors and pharmacists. But imagine this. Pretend I am your doctor. You tell me everything in your own words, and I explain everything slowly and clearly. You learn simple English that helps you speak with doctors and pharmacists easily.
That would be amazing. I want to feel confident and calm, not scared and confused.
And that's exactly what we will do today. This video will help you speak English at the doctor and pharmacy like a pro. You will know what to say, what to ask, and how to understand your care. So don't miss even a second. And please subscribe to Just Say English to get more videos that help you learn real English for real life.
Yes, let's get started. No more fear at the doctor's office.
Good morning, Ramo. Please have a seat. You look tired. How are you feeling today? Tell me everything. Don't worry, just speak freely.
Thank you, Dr. Sophia. To be honest, I'm not feeling well at all. For the past week, I have this dry cough that just won't go away. It feels like something keeps sticking in my throat, and it makes me want to cough all the time.
That sounds really uncomfortable. Has your cough changed in any way? Is it worse at night or during the day?
It's definitely worse at night. When I lie down, my throat feels very dry and scratchy, and I wake up coughing. It's hard to sleep. And during the day, sometimes I feel tired and out of breath, even when I'm just walking slowly.
I'm sorry you're going through that. Being tired and losing sleep can make everything harder. When did the cough start exactly?
It started about 7 days ago. At first, I thought it was just a normal cold, but it didn't get better. It stayed the same, and now I'm worried it might be something more serious.
I understand the worry. Have you had a fever at any time during these days? Even the small temperature?
No high fever, but sometimes I feel cold and have chills. It's like my body shakes, especially at night.
Do you notice any pain in your chest, like a sharp or dull pain, especially when you cough or take deep breaths?
Yes, sometimes when I cough hard, my chest feels tight and a bit sore. It's uncomfortable and makes me cough more.
That detail is very important. It helps me understand what's happening inside your lungs. Do you have any allergies to medicines, food, or anything else that I should know about before giving you treatment?
No, I don't have allergies that I know of, and no reactions to medicine in the past.
Do you smoke or live around smokers?
No, I don't smoke, and my family doesn't smoke either.
Good to know. I will examine you now. Please try to relax. Take a deep breath in and out, slowly. We will check how your lungs sound. Ready?
Yes, doctor.
I hear some wheezing and a bit of inflammation. This often happens with respiratory infections. I'm going to give you antibiotics to fight the infection and a cough syrup to soothe your throat.
Thank you, doctor. How exactly do I take these medicines? I don't want to make mistakes.
It's very important to get this right. Take the antibiotics 2 times a day, always after meals. This helps protect your stomach and makes the medicine work better. Take the cough syrup 3 times a day. One dose when you wake up, one in the afternoon, and the last one before you go to sleep. Even if you're feeling better in a few days, make sure you finish all the medicine. Stopping early can make the infection come back or make it worse.
I understand. What if the medicines give me side effects?
Some people might feel mild nausea, dizziness, or upset stomach. These usually go away after a few doses. But if you notice something serious like a rash on your skin, swelling of your face or throat, or difficulty breathing, come back to see me immediately or go to the emergency room. Never ignore these signs.
That sounds important. I will watch for these signs carefully.
Also, if you feel very tired or if your cough gets worse instead of better, please come back. Your health must be our first priority.
I will. Thank you so much, Dr. Sophia. You make me feel much better already, knowing I can ask questions and understand.
That's what I'm here for. Remember, always speak openly with your doctor. The more you talk, the better we can help you. Now, let's prepare for your next steps to get you better. Hello, Ramo. Welcome to the pharmacy. How can I help you today?
Hello, Sophia. I have a prescription from Dr. Sophia for some medicine. Can you please help me?
Of course. Let me take a look at your prescription. Okay, here are your medicines. You have antibiotics and a cough syrup.
Thank you. I want to make sure I take these medicines the right way. Can you please explain how I should take them?
Sure. The antibiotics you must take 2 times a day, always after eating food. This helps prevent stomach upset. The cough syrup should be taken 3 times a day. One dose when you wake up, one in the afternoon, and the last one before you go to sleep. Be careful to take the syrup at the right times, especially before bedtime. It helps with your cough during the night.
Okay, 2 times for antibiotics and 3 times for syrup with food and before bed. Got it.
Very good. Also, remember to finish all the medicine, even if your cough stops or you feel better. This makes sure the infection is fully gone. Do not stop the medicine early.
Yes, I will finish the whole course.
Great. Now, do you have any questions about the medicine?
Yes, I have a few questions. Can I drink tea or coffee while taking these medicines?
Good question. You can drink tea, it's fine, but it's best if you avoid coffee and alcohol while you're taking these medicines because they can irritate your stomach and make the medicine less effective.
I understand. What if I forget to take a dose? What should I do?
If you forget, take the missed dose as soon as you remember. But if it's almost time for your next dose, just skip the missed one. Never take two doses at the same time. That can be dangerous.
Okay, no double doses. Got it.
Sometimes antibiotics can cause side effects like feeling dizzy or an upset stomach. These often go away quickly. But if you notice serious symptoms like rash, swelling, or trouble breathing, come back to your doctor or emergency room right away.
That sounds serious. I will watch carefully for these signs.
Perfect. Keep the medicines in a cool, dry place, away from sunlight, and out of reach of children.
Thank you for explaining everything so clearly. I feel much better now.
You're welcome, Ramo. Always ask if you don't understand something. It's important to be clear about your health. Stay safe and get well soon.
Sophia, I want to tell you how I am taking my medicine. This morning, I took my antibiotic after breakfast, just like you said.
That's great, Ramo. You're doing well. Did you take your cough syrup last night before going to bed?
Yes, I did. But sometimes I get confused. I forget if I already took my medicine or not.
That happens to many people. A good way to remember is to use a medicine schedule or set phone alarms. You can write down the time you take your medicine or use reminders on your phone. This helps a lot.
That sounds like a good idea. I will start doing that.
Also, it's important to eat food before taking antibiotics. Taking medicine on an empty stomach can cause upset stomach or nausea.
Oh, I didn't know that. I will always eat before taking my pills.
And remember to drink plenty of water. Water helps the medicine work better and keeps you healthy.
I will drink more water from now on.
If you feel dizzy, very tired, or your tummy hurts a lot, tell your doctor immediately.
Okay, I will. What if I cough again or feel worse?
If your cough comes back or your symptoms get worse, come back to see the doctor. Don't wait or ignore it.
Thank you, Sophia. I feel more confident now. Talking like this helps a lot.
That's wonderful, Ramo. The more you